The following segment is sponsored by Intermountain Healthcare.
Hey, we've got our Intermountain Healthcare experts here today. It is Heart Day, Valentine's Day, of course, and we want to talk about heart healthy today. I've got Dr. John Melman, electrophysiologist with McCady Hospital here with us, talking about when your heart's out of rhythm. There's two kinds. We're talking a little bit about A Fib, which is the one that probably is a little bit safer than V Fib, right?
That's right. It's a lot safer. It is a lot more frequent. Probably one of the most frequent and important arrhythmias that we treat as cardiologists.
How do we know if we have it? Is it shortness of breath? We just feel out of sync?
So there can be a number of different symptoms. They can range from just occasional palpitations, a feeling of your heart racing. Some people have debilitating symptoms like shortness of breath and even congestive heart failure.
What part of the heart is A Fib in?
So if you look at this model, AFib is a problem with the atria,
right.
The upper chambers of the heart up here. In normal rhythm, the upper chambers and the lower chambers, the ventricles work in sync with each other. The atria beat first and then the ventricles. Right. In atrial fibrillation, the atria aren't really beating, they're kind of wiggling. We call it fibrillation hundreds of times a minute.
Now, V-fib is the one that could be really, really serious, and that could be a killer, right?
That's right. Whichever chamber is fibrillating is really not pumping any blood. The ventricles are the main pumping chambers of the heart. If those are fibrillating, that is basically a cardiac arrest. In atrial fibrillation, the ventricles continue to pump.
Okay, we got 30 seconds. If somebody's they think they're having a problem, it's imperative they go get checked out, right?
It absolutely is. Untreated atrial fibrillation can lead to congestive heart failure, like I said. It is also a risk factor for causing strokes. So if you think you have any of the symptoms we discussed, it's important to talk to your primary care physician, talk to your cardiologist, or see a heart rhythm expert.
All right, and we've got the experts to do just that. They can talk a little bit about treatment. All you have to do is call 877-908-0680. Doctor, thank you. Shauna,